Tonight on Nation to Nation, the COVID-19 pandemic, remote and northern First Nations scramble to prepare.
It is a race against the clock. If COVID hits, it's going to hit hard, and we're scrambling to put basic supports in place.
Ottawa announced billions in funding responding to the pandemic. That includes $305 million for Indigenous communities.
Is it enough? I think we'll have to kind of play this out and see how each individual community reacts to the needs that they...
Hello, I'm Todd Lamoran, and welcome to Nation. There's only one topic on the minds of many Indigenous peoples right now, and the Prime Minister and a committee of cabinet ministers have been giving daily briefings on COVID-19. But until today, Indigenous Services Minister Mark Miller had not participated. To talk about what he had to say and other details of interest to Indigenous communities, I'm now joined by Dr. Tom Wong, the Chief Medical Officer for Public Health at Indigenous Services Canada, and Valerie Gideon, Senior Assistant Deputy Minister for the First Nations and Inuit Health Branch. Welcome to Nation, Dr. Wong and Ms. Gideon.
Thank you.
Thank you.
Now, what is the $305 million that was recently announced for? We heard it was for immediate needs. What does that mean?
So it's intended to be a very flexible fund for Indigenous communities to draw upon. It will be taking a distinctions-based approach, so specific allocations for First Nations, Inuit, and Métis, for communities to address broad social support systems that are required at the community level. So that can be anything from additional transportation measures, if they're requiring additional supplies to support families, whether those are household items or food, if they need to compensate community-based workers, right, for loss of wages during this difficult time. So really, it is for leadership to be able to fully activate their all hazards or pandemic plans in their communities and really listen to the needs of their community members.
Now, I also heard the term surge capacity, that there's a talk of a team ready to spring into action. What exactly does that mean?
So Dr. Wong mentioned that at the press conference today with Minister Miller. We are looking at a variety of mechanisms, so also recruiting within our own staff, but we also have emergency contracts putting in place for nursing agency supports, relief supports. We're looking at paramedics as well, and other health professionals that can step in. So we also have an ability to draw health professionals from across the country in order to be able to ensure that those communities that require that surge capacity, where they may have more individuals that are affected at any one time, that we've got the flexibility to bring them in as required. I'm not sure if Dr. Wong, you'd like to add anything more?
Should the communities need them?
Absolutely.
What is the threshold for sending in this extra equipment and personnel that you're talking about? One or two positive cases, or is it something more?
Community leadership, and we have close relationships with communities across the country, will advise us when they get to that point of stress, right? So if they see that their existing health professional staff in the community are no longer able to manage, they will give us a call. And also with respect to communities where we're directly providing health services, the minute that COVID-19 starts to affect those communities, we will be on a daily and multiple times daily conversation with the local health providers to see how things are going, what kind of supports they require. We have incident command structures across all of our regional offices and here within our department at the national office. We are receiving very regular updates with respect to what's happening on the ground from our regional offices and at the regional level from communities. In BC, I just wanted to point out that the First Nations Health Authority in BC really runs those operations for British Columbia First Nations communities, but they also have their command system in place as well.
And we will not leave any community behind.
Now, earlier today, Minister Miller talked about the vast majority of First Nations having an emergency plan based on the H1N1 pandemic. But what's the fundamental difference here, and where do they really need to update that plan?
That's a very good point. You know, I think I was responsible for managing the Ontario Regional Office of the department in the area of health during the H1N1 situation. And I would say that we have a lot more supports today than we did at that time in terms of advanced planning, in terms of knowing where there could be vulnerabilities. For instance, ensuring that we've already adapted our medical transportation policies through the non-insured health benefits program so that any individual that would be more susceptible to COVID-19 is using private modes of transportation to the maximum extent possible. So instead of going into public transportation, they would be using a private taxi, or instead of going into a boarding home, they would be using a hotel room. So we have learned lessons. We also have a clear governance and coordination mechanism. We have had new resources since Budget 2019, specifically for First Nations to ramp up their capacity to address health emergencies at the tribal council level, in First Nations health authorities, and in First Nations communities. And that capacity did not exist during the H1N1 situation. So we have a lot of things in place. We've even adapted the tracking tool that we were using during H1N1 in one particular region that was very effective, so that it's deployed across the country today. But communities have had changes, right? Like they've had an increase in the number of community members. They probably have had changes in their demographics as well. They have to look at particular vulnerabilities here with respect to individuals with chronic disease, the older cohort and population. And the other thing is that we do not have the same degree of antiviral treatment or a vaccine that we know may be coming in relatively short order. Those were things that we were able to do in the context of H1N1, which is not currently available. And so there is more reliance on self-isolation, limitations with respect to group settings, so that people are not as exposed to COVID-19. So the measures are somewhat different than what communities were recommended to put in place during H1N1. And I'll just quickly turn it over to Dr. Wong to see if he has anything more to add.
Well, thank you, Valerie. We have also developed tools for communities to use in order to help them support the planning for, as well as exercising, testing, those emergency plans, and to support them if they need to activate the plan and to implement the plan as well.
Finally, Minister Miller said if there are any questions, leaders should contact him and his team directly. But what can you do if the call comes in from First Nation that I've got X amount of cases and the nurse at the nursing station is feeling overwhelmed? What happens?
So we have full-time health emergency coordinators in all of the regional offices. We have regional medical officers of health. We have directors of nursing. We have nurse specialists in communicable disease control emergencies. And I appreciate the minister offering himself and his team to be in close contact with communities. I think it's very important for leadership to feel that commitment from the government. But we do have capacity to help support communities during this time. And we are inviting them to reach out to our public health specialists and to our coordinators in the area of emergency management so that they can help them to quickly activate their plan and mobilize resources. We are closely going to be sharing out a guide to communities who have additional requests for support that they need, just to clarify the contacts they can reach out to. And we've also recently updated the contact information on the department's website to also ensure that that's up to date and people know who to call.
Ms. Gideon and Dr. Wong, I want to thank you for your time.
Thank you very much.
My pleasure. Thank you.
After the break, I speak with the Conservative Shadow Minister for Indigenous Services, Saskatchewan MP Gary Vidal. Welcome back. Gary Vidal is the Conservative Party's Shadow Minister of Indigenous Services. He also represents a riding in northern Saskatchewan where First Nations and Métis people make up the majority living there. Yesterday, the federal government announced a multi-billion-dollar economic aid package with $305 million being set aside as a support fund for Indigenous communities. To speak about that and other issues, I'm now joined by Mr. Vidal from his home community of Meadow Lake, Saskatchewan. Welcome to Nation to Nation.
Thank you, Todd. Good to be with you.
What are you hearing from First Nations and Métis communities in your riding? Just how much concern is out there?
You know what? I've talked to a number of them over the last few days. I've talked to a number of kind of the tribal council chiefs, to the FSIN chief, and also some of the individual leaders of the there's some independent First Nations, and also just some of the individual chiefs of the First Nations. And there's a number of them that are actually very well prepared. They've made the effort to be ready, and they're doing everything they can to educate their people and take precautionary measures. But there's also a pretty significant level of concern for their communities if this, if it gets into their communities and starts to expand in those communities. So it's kind of a balance between preparedness and some sincere worries on behalf of the people.
You mentioned you talked to the Federation of Sovereign Indigenous Nations. The Grand Chief Bobby Cameron has been a little concerned that not enough is being done for northern Saskatchewan communities. For example, testing is the closest community I'd imagine be Prince Albert. I suppose, what do you think of that?
You know what, I think that is one of the challenges is, trying to make all of those services as accessible as possible. And that's some of the conversations I had with Minister Miller earlier in the week about how do we make sure that the services are available to those northern and remote communities. And I followed up with some conversations in his office again this morning with his chief of staff, and follow up to some of the announcements about the $305 million. And we're just trying to work collaboratively with his office to make sure those messages are getting out, to make sure that if there is some holes or some areas where things need to be done very, much better, that we can be a conduit for that message to get right through to the minister's office. And so, I assured Grand Chief Cameron this morning that I will take his message for. I mean, he has access to these people as well, but the more voices and the more people involved in the mix, I think the better it is for the people on the ground.
Now, you mentioned, and I mentioned it in my intro, is $305 million that's been earmarked as an Indigenous Community Support Fund. Is that enough? And at this point, do we know how that money would be spent? Because it's only a few $100,000 per community.
You know what? When I talked to the Chief of Staff this morning, the details on that are still being worked out on how that's going to get flowed out. But I know one of the things he said to me was there's that $305 million, there's the $100 million that they announced last week. And one of the things they've recognized is that $100 million is not getting out to the communities as fast as they would like to, or as it should. And that's the concerns I'm hearing from the people on the ground as well. So, they assured me that this $305 million would have a mechanism where it could get to the people on the ground, to the local communities as quickly as possible. The other thing I think to keep in mind is that, all of this money is in addition to what the announcements made this morning as far as what all individuals, what all businesses, all of those things that are available to everybody else are available to all our First Nations communities as well. So this money is on top of that. Is it enough? I think we'll have to kind of play this out and see how each individual community reacts to the needs that arise in their communities, and just see where those needs end up, and see if the government's open to more resources if that time's come where it's necessary.
What specifically do you think this money needs to be directed towards? Is it getting more health equipment? What have you been hearing where the greatest need is for more spending?
You know what? I think there's going to be. I hope when they use their language, distinctive based approach. If I'm interpreting that correct, I think what their desire is to let some of those communities figure that out for themselves. So, some of the things that I've heard in my conversation with the chiefs in my northern riding is food security is a big issue. For example, we have some remote communities that the leadership of the communities is very concerned that the people leave the community to go into, say, Prince Albert, for example, to get their groceries, to get their food supply, and then they come back to their community because they don't have a store in their community. I think there's a big concern there that they're going to kind of go out into the place where they maybe pick the virus up and bring it back. And so there is some initiatives being looked at by certain communities that would say, can we go in and get some, get some food supply and bring it to our community so that our elders, so our people that are more vulnerable don't have to leave the community and can stay safe. So I think that's one example of an initiative that could be utilized by that particular community. Other communities are talking about things like the access to their community is through lake roads, and those lake roads are not going to be there for the long term. So the fly-in communities that maybe some are already that way, and some are going to become that way shortly when the winter roads are lost. They might have a different need than say another community. And then I think the overarching thing is the medical supplies and the needs that are going to arise that way. And I'm in talking to some of those leaders as well. I think one of the things they talked about was how they had all developed pandemic plans after the H1N1 crisis a few years ago, and that they were working at, if I could use the phrase, dusting off those plans to make sure that they're ready and make sure that they have the supplies in place that they may need as this situation develops.
Well, we'll have to leave it at that, Mr. Vidal. Once again, I want to thank you for speaking to me.
My pleasure, Todd.
Another short break, and we'll be back with another Member of Parliament. This time, NDP MP Charlie Angus. Welcome back. Information about the COVID-19 pandemic changes almost hourly. Cities have effectively shut down, but what about Northern Ontario, particularly remote Cree First Nations? As we've already heard, the federal government has committed hundreds of millions of dollars for First Nation safety. Our next guest has been sharply critical of Ottawa's response in the past. Charlie Angus is the NDP MP for Timmins-James Bay, and just 3 days ago said First Nations in his riding weren't prepared. Welcome to Nation to Nation, Mr. Angus.
Thank you so much for having me.
What are you hearing from the First Nations in your riding? Are they concerned, or is anybody scared right now?
Well, right now, everybody knows that this is a race against the clock. And it's not just in Treaty 9 in Northern Ontario, but all across Northern Canada, in the far north reserves, where we have substandard healthcare at best, third world healthcare in many instances. In other parts of the country, I think there are really good plans in place to try and, break the back of the curve to slow this thing down, but there are still shortfalls in ventilators and testing swabs. Well, when you get to the far north, the shortfalls are magnified 1,000 times. Just the other day, I was talking to people in Casablanca Lake up in northwest Ontario, where they were going out in the bush and getting cedar to try and get traditional medicines because their medical clinic didn't have any support. So the government's made a number of announcements. Certainly in Treaty 9, Anishinaabe Nation has set up a very impressive medical response team to try and make planning, but it is a race against the clock. If COVID hits, it's going to hit hard, and we're scrambling to put basic supports in place.
As I mentioned earlier, up to a few days ago, you're very critical of the federal government. But what about the latest announcements? Yesterday, there was an announcement of an additional $305 million for Indigenous communities.
I'm very pleased to see that in Ontario region, both the province and the feds have made announcements that they're going to step up. With Treaty 9, they've got an emergency response team that has some very good people that I have a lot of respect for. Jane Philpott's on the team. Dr. Michael Curlew, who's been a really outspoken advocate for First Nation health in the far north, is on that team. And what they're scrambling to do is put plans and supports in place. There are a lot of variables, a lot of unknowns. If COVID gets into one of the communities with the overcrowded houses and the compromised immune systems, we know we could be looking at a medical catastrophe. So my frustration with the government is that we've known this has been coming for weeks and weeks and weeks. We've lost a lot of time. Can we make this up? I hope so. But, I'm talking to people in northern Saskatchewan who are facing the same issue. People in northern Manitoba are facing the same issue. This is the reality in Indigenous country, is that it seems now it's a top-of-mind issue, whereas it should have always been a top-of-mind issue, because we need to deal with these substandard health systems that we have for First Nation communities.
You mentioned northern Saskatchewan. We just spoke to the MP for northern Saskatchewan, Gary Vidal, and he was saying that some First Nations are dusting off their old H1N1 plans. Is that good enough? Do you think that's enough to prepare First Nations?
Well, certainly in all the far north communities, they're trying to update their pandemic planning. But even with planning, where's the resources? We've got health clinics that don't have proper supports in place, that don't have, the proper enough oxygen tanks. We don't have gloves. We don't have masks. We don't have hand sanitizers. And of course, wash your hands in communities where you get blisters because the water's not safe. So this is the reality. This is what we're having to deal with. I was very disturbed last week when the government talked about maybe bringing tents in. It's still winter conditions in the far north. Tents is not where you want to put people with compromised immune systems who are fighting COVID-19. So I'm hoping that the emergency teams that we have in place for Treaty 9, they're making plans, they're trying to figure this out. This is what they're talking about, is what do we do, how do we respond if it hits. And we see many communities are moving to try and limit all traffic, unless it's vital to get supplies in. But other than that, try to limit the contact, hopefully keep COVID out of some of the communities, and then we'll see where we go from here.
You mentioned that so you're talking about a lot of communities across Canada are going towards self-isolation. Do you think that's something that all the communities in your riding should be thinking about doing?
I would tell everyone if you're outside the community, it's probably best to stay outside the community for now. Having people come back, people fly in, fly out, that could be the movement of the vector of this virus, and it will have huge impact. So the more we limit it is crucial. I'm pleased to see they're talking about making sure that there's going to be food supplies available, and some of that there will be, I've been told, I don't know if it's been set up yet, but they're going to be talking about helping to have food supplies for First Nation families who are falling through the cracks, even in some of the more urban centers like Timmins and Sioux Lookout, Thunder Bay. So that will be helpful. The big unspoken issue here is we're just shy of the evacuation season, the flooding season in the far north. Saskatchewan will be under incredible pressure with 2,000 people at risk when the floods hit. So these issues are all coming on us at the same time. We've lost a number of weeks. I think the government was not prepared. I don't think they took it as seriously as they need to. That being said, let's get that money, let's get the planning, and let's see what we can do to keep COVID out of the northern communities.
Mr. Angus, I want to thank you for taking some time to speak to me.
Thank you so much.
That's our show. Now, I'm sure some of you have time on your hands, especially if you're self-isolating. So if you've missed a previous episode, I urge you to check out our Nation to Nation podcasts. Go to aptnnews.ca/podcast. I'm Todd Lamoran. Thanks for watching, and stay safe.